About 3% of the population have bipolar disorder or had it at some time in their life. In most cases, people don't talk about it because of all the stigma that's attached to it.
If you have ever been in therapy, you are likely to be used to your therapist's private life being a mystery. But today's guest, who is a psychotherapist, absolutely blows that theory out of the water. And I could not be more impressed with her candor and more pleased to introduce you to Marcia Naomi Berger, who is the author of several books. But today we're going to be talking about a book that she has recently written entitled The Bipolar Therapist. Marcia, you just heard me reference the fact that for years, I mean, certainly traditionally trained therapists have been taught that you never say anything about your personal life, period, end of story. What made you decide that this was the time for you to share your own personal journey?
It took me a long time to drum up the courage to write The Bipolar Therapist because of all the shame and stigma I experienced from colleagues and a couple of friends who ghosted me. And because I probably got to the point where I wanted to do two things. One is probably the catharsis of being able to be open, like to come out of the closet after having to hide really a big part of who I was for quite a while. And the other part is that I really wanted people to know that there should not be stigma. My dream is for people to view people with a mental illness with the same kind of compassion, understanding, and respect that they would show to somebody with a physical illness. And I think telling my story, I hope, goes somewhat towards achieving that goal. And it's a big goal.
It's a big goal, but it is a critically important goal. So I would imagine that many people have thanked you for your work. I would like to join that chorus because what you've shared and what you're talking about and teaching us about is so vitally important. For those listening who don't know, what exactly is bipolar disorder?
Bipolar disorder is a mood disorder, and it comes in two forms. The form that I had back when I had it, it was called manic depression, and sometimes it's still called that. And that is characterized by manic episodes, like thoughts that keep racing and lack of sleep. And it's almost like there's no censor to what you're saying and how you're behaving. The second form is characterized more by depression. And there can be something called hypomania, but it doesn't get to the point where they need hospitalization for the highs that they're experiencing. Whereas with the first part, the first kind is the kind that I had again, and that becomes extreme enough that hospitalization is not unlikely.
Now, I just want to take us back a second because as you very well know, there's so many myths about mental health just in general. And the notion is often either you couldn't do anything or you can't do anything. But in fact, you held several senior level positions in several mental health areas of concentration. You've certainly written books. We've had you back on in past years, talking about some of the books that you have written. What would you say is one of the perhaps largest, most damaging myths about mental health and mental illness in general? Is there one?
That is an interesting question. I think the myth is probably incompetence in general, that they're not competent. They're not competent because I know that was certainly my experience. I don't know if it was exactly that way because, for me, but in general, it's like you can't trust this person. You don't know what they're going to do, when they're going to act very weird, and who knows what they're going to do. So people do want to keep their distance. And for me, I was really shamed badly by colleagues, and I was working in an alcoholism treatment center, and people think that, well, how do I say it? Like you were saying, therapists are kind of private about their personal life, um, and I had a really good reputation in this agency where I worked. I was training people for how to do therapy and how to do family therapy. But once it got out that I had this mental illness, people were nasty, nasty, humiliating me. And you would think, why would these professional therapists be so lacking in compassion and understanding? And
Right.
I have an answer for that if you want me to
I'll
go
take
on.
the
Or,
answer. What's your answer?
back then, and probably still now, if you're a therapist and you work in an agency, it's really considered just fine, even like a common day, like noteworthy, good thing if you're in therapy for an everyday neurotic kind of issue.
Right.
I think what happened was that I crossed the line by becoming psychotic, and that tapped into some kind of unconscious fear. If it happened to her, it could happen to me in the minds of the people that were cruel.
I think that's a really interesting point. If it happened to her, it could happen to me. And so for a lot of folks, the way to deal with that is to pretend that you're bad and they're not. And so they're absolutely always safe. You talked about some of your colleagues really being unpleasant. What kinds of things did they say? What kinds of things did they do? And what happened to your job?
Okay, well, it's almost funny and ironic what happened eventually, but not at first. At first,
I'm sure.
When I started taking medication, I was doing fine. When one of my colleagues, this is actually in my book, The Bipolar Therapist, that another social worker and therapist knew that I was taking lithium, and he made a little song about it. And he's like, I know what you're taking, and it starts with an L and then an I and a T, and he spells it out. And this was in front of a secretary. It was in an office in our clinic.
I said, is it okay that I'm
It's horrible.
horrified?
Yeah, it's horrible. I was actually, I don't know if you call it, I was harassed, whether you call it sexually harassed. I don't know, maybe. Oh, definitely. Yeah, definitely. Oh, at work. And that was before the Me Too movement. And so there was nothing I could do about it. But meanwhile, once I was on medication, which took 3 hospitalizations before I would agree to take medicine, since a big part of mental illness for many people is denial. It's just stress or some excuse for why I did what I did. And but finally I did start taking medicine, and that was when I kept going. And the ironic thing that it's not really funny, but it's ironic, I'd say, that because my job, they couldn't fire me easily on that job. And I was recruited to work on a psych ward after I was on lithium for a while. And I don't think anybody knew on the psych ward at San Francisco General Hospital that I had a diagnosis or that I was taking medication. And I did really well there. I was highly regarded and was given a clinical faculty appointment at a university to recognize the training that I had provided for some of the psychiatry residents at the psychiatric hospital where I was working. And so that, and then it went on my career. So I became executive director. A few years later, I became executive director of a family service agency, and then went into private practice and realized that I just loved working with couples and families, but especially helping couples create fulfilling marriages. And I started writing about it and have a couple of books out about that.
So, what's interesting is that what you're describing absolutely flies in the face of this myth that if you have a mental health disorder, you can't do anything. You were able to get on medication that was really useful for you, and absolutely you thrived in your career, being offered more and more challenges and doing well in your career. As your diagnosis became more known to people, so they forgot about all the things that you had done? I mean, how did that happen?
I think it was that the stigma that these mental health professionals were not immune from. They're people like everybody else with their own issues, and not everybody was horrible. I fortunately had a couple of very loyal friends on that job, and that helped me enormously. And I also had an extremely loyal friend who called me just about every night to talk to me, and I tell her about my day at work, and she told me that there is this free floating hostility in the air wherever you are, and it lands on whoever is vulnerable.
That's an interesting point, and I think unfortunately that's true perhaps nowadays more than ever for reasons unrelated to mental health, really sort of related
Right.
more to the social health or the lack thereof. Marcia, just want to take a break for a second and remind people that M.E.S.H is the place that is designed for you to learn about your mental, emotional, and social health. I hope that you will join us every week. I hope that you will like, subscribe, and share today's conversation and in all of our conversations with people that you care about. I'd like to go back to the conversation with Marcia. Marcia, you had to make decisions about relationships. What about romantic relationships? Did you have to make any decisions or changes in your romantic life?
I definitely made some changes in my romantic life because for a long time I had a pattern of pushing away men who were interested in getting serious marriage, and pining after the ones that were more into recreational dating than commitment dating, and
I
so
like
it was a
that
big
term.
change for me. With the help of therapy, I've been married for almost going on 38 years now. So
That is quite
I've also
extraordinary.
been off. I'm not taking medication. I haven't had to take medication. This is defying the myth that bipolar people with bipolar never get better. They have to take medication for life. That's not true in my case. But for many people it is. So I would encourage people, if they want to change their medication, not to do a thing without talking to their professional psychiatrist or mental health qualified professional.
Absolutely. But again, you bring up something that many people believe, which is that once you have a mental health diagnosis, if it is a diagnosis that requires medication, and nowadays insurance companies really like you to be on medication versus therapy. Whole other conversation. I won't go there. It was just my own personal aside and perhaps bias. But the theory is that once you're on medication, you're always going to be on medication for your mental health disorder. But that was not the case for you. Can you say more about that?
Oh, okay. I don't want to be a spoiler or give a spoiler for the book, but I'll do it anyway, I guess.
Just a brief comment.
Okay, all right. Here's how I'll put it. I'll say at one point in my life, after I was married for a couple of years, I guess, my psychiatrist wanted me to try getting off the medication for 2 weeks and seeing what would happen. And I was petrified to get off the medication.
Sure.
But we agreed, and my husband agreed he'd keep an eye on me in case I started acting peculiar, more peculiar than a normal kind of person, that is, and because we all have our stuff. But
Absolutely.
I went off it and it didn't make any, I was fine and I didn't take it anymore. So I've been off it for no medication, no therapy for bipolar disorder for, I don't know, something like 33 years or so.
So a very long time. I mean, you make a good point. If you even if you feel like you want to be off the medication, and a lot of times when you're in the manic episode, you really kind of feel like you don't need the medication. But your point is that if you want to come off the medication, really do that with the guidance of your medical and your mental health professional. That's the best way to go because they are better able to guide you if that's something that really is a good fit for you. In your case, it was a good fit. For some people, it's not a good fit, but that doesn't say anything about their value in society or their ability to enjoy their profession or their relationships.
Yeah, and that I wanted to say something about how what made me so frightened of getting off it because there's so much denial where people don't want to get on it in the first place or they voluntarily go off it without consulting a professional, and there have been disastrous consequences. I think a big thing that kept me on it and frightened of going off it was I was working for about 4 years on the psych ward, and we called it the revolving door. Patients would come in psychotic often to get on medication. They go out. They don't like to take medication. There could be side effects. And instead of trying to deal with that with a professional, they go off it and then back on the psych ward end. Same people come back, many of them over and over.
Right.
And so I didn't want to be one of those people. And so it was a reminder to me, just stay on it.
Yeah. Makes a lot of sense. Let me ask you this. How can family and friends be supportive if they discover that someone has trusted them enough to let them know that a mental health diagnosis is afoot? What can they do?
Well, it depends, of course, on each situation. But if the first thing they can do if a person is resisting taking medication or wants to go off it is to encourage them to talk to their doctor, their psychiatrist, or whoever is prescribing the medication. Maybe they have side effects, and I did actually at first. I fortunately my psychiatrist lowered the dosage, and then I was fine. But I was getting a little bit woozy, and so this is what my friend did for me. She said, "Why don't you talk to your doctor?" And he did it. And I was so fortunate because he put me on lower than the standard dose for that medication, which is not prescribed as widely as it used to be because of the side effects that many people experience. If somebody refuses, if somebody's actively, if they're in a psychotic state, whether they're schizophrenic or whether they're bipolar or extremely depressed or anxious, whatever it is, if they are in denial, you cannot change that. You can give it a little try. I love you. I care about you. I wish that you would take the medication or see somebody or see a professional. But if they're in denial, no matter what you do, stop trying. Stop. You cannot expect them to be reasonable if they're in a psychotic state. But you can still be compassionate and kind. And you can have boundaries. If they want to talk to you for hours on the phone, you may have to go off saying whatever reason, I'm pretty well talked out now. I'll talk to you later. Bye.
Okay. All right. Let me ask you this question, and I'm going to ask for a quick answer, although I know that there is no quick answer, but time is getting away from us. You've used the term psychotic, and for folks who don't know what that means, can you give us just a tiny glimpse of what a psychotic episode would look like?
Well, I can say like a manic episode, which I mentioned earlier, is that with a grandiosity. They have I thought I had special powers.
Okay.
A very specific one was I was on a flight from California, where I live, to New York, and we stopped in, I think it was in Chicago, and so we had a break. I'm wandering around the airport, and I believed that everybody that crossed my path, I could cure whatever everybody was. I was feeling a lot of like compassion for people, but also totally unrealistic that by looking at them, I was curing them.
Okay.
So I can look back and say it's kind of funny, but at the time I really believed it. And yet somehow I still made it back to the plane on time and went on the trip, and then had my big episode. And really, we become, if we're psychotic, we're not very sensitive to what's going on with the people around us, except maybe we see some fear in their eyes about so looking at us being crazy.
Yeah. That's great. I mean, I just wanted a thumbnail sketch, and you certainly provided that. I appreciate that. Marcia, before we go, and we're going to go in a half a second, how can people get a copy of your book, The Bipolar Therapist?
Okay, they can certainly get it online at the usual places. They can, if it's in their bookstore, great. Otherwise, they can ask for it and get it that way, or get it from the library. The easy way to remember my website is Marriage Meetings, with an S on meetings, marriagemeetings.com. And that has it. Here it is. Bipolar.
The Bipolar Therapist. Like. Terrific. That's great. Thank you very
much. The subtitle of the Bipolar Therapist, I mentioned.
Thank you so much for joining us. And I'm absolutely am appreciative of your book. Thank you so much. Folks, and I want to thank you
for having me here.
Absolutely. It's my pleasure. Folks, I want to thank you again for joining us on this edition of M.E.S.H. I am asking you to like, subscribe, follow, and share as much as you like. And I look forward to seeing you next week. I'll be here, and I hope you will be too. Take care.